Today we'll be talking about the best position to place a patient on when they are having breathing difficulty. Let's say, for instance, you went to an accident scene and then you see a patient, you see people lying down, and you saw somebody that is maybe breathing out, breathing in and out like this, having labor breathing, or you see somebody that is gasping for air. So these are sensitive time for you. You need to come in and help that person, irrespective of your cadre. Maybe you are not even a health worker or something. You need to come in and help that person. So the best position to place that person on is, let the person sit in between your leg like this, meaning you are going to help the person to rest his or her back on your leg. Or better still, if it's close to a wall, you can use something to support the person. Let the person be resting on the wall. Just look for a way to just help the person to sit upright. That is what I'm trying to tell us. Sitting upright is going to help that person. These are the advantages of sitting upright. It's going to help the lung to expand. You know, this person is having issue with taking in oxygen and bringing out carbon dioxide. The person is having issue with it. So sitting that person up is going to allow the lungs to expand. So in hospital setting, I'm going to mention two positions for us that we can actually place this patient on. The first one is semi-Fowler position. Yes, place the patient in semi-Fowler's position. It's going to allow the patient to be able to breathe in air, breathe in oxygen and then take out carbon dioxide. It will allow the lungs to expand a little bit. At worst, you can also put, if you notice that the semi-Fowler position is not really doing justice, maybe you check your SpO2 and then you notice that the oxygen level is not up to 95. The best number we are expected to have is from 95 to 100 for normal people, like people that are healthy. So maybe you check and you notice that the person is having 93. There are exceptions to that 93. Let's say, for instance, somebody have a COPD. If somebody have 92, 91, is not a problem. For those that have COPD, that is a chronic obstructive pulmonary disease. But in a situation whereby the person is a normal person like me and you, the way we are breathing in, we are breathing out without any stress, and then you now notice that the person is not having this kind of problem. Maybe the person encountered one or two things, maybe bike fed the person, or something just happened. Don't just sit down and watch. Immediately you notice that the oxygen, maybe you get, even though it's 94 you get, in hospital setting, even though it's 94% of the SpO2 you get, try and sit that person down. Raise the bed up. Raise the head of the bed. I don't mean the foot. Raise the head of the bed up. Let the person be able to stay in either semi-Fowler position. And then if you now notice that this person oxygen level is in fact maybe like 92, 93, is going down, put the person in Fowler position. Although it depends on your medical doctor instruction, but sometimes people can be overwhelmed with work and everything. You can actually come in before they will come. We are actually working like team. It's teamwork, so you can do, as far it will benefit the patient. You can do one or two things, and then when you come, he reassess, and then he will, if you are to continue, he will let you know, or if you are to stop, he will let you know. So what I'm trying to say is, let's try and place patient well on bed, depending on patient condition. I saw what prompted this video was, I saw a video where I don't know whether it's the patient relative that actually did that video. Definitely it might not be a health worker that did that video. So I saw that video whereby this person was having issue with breathing. It's even a lady, yeah. But I couldn't watch further, because immediately the first thing I look at was, okay, this person is having a breathing problem. Okay, what is the position? I saw this person lying flat on bed. Are you for real? Immediately I saw the person lying flat on bed on stretcher. Oh my God! In fact, I had heartache immediately. I was feeling pity for the person. In fact, so many things were just running in my mind, like what will happen to this person? I couldn't really calm down and watch because it's going to toll with my emotion, and I don't like anything that toys with my emotion. So I just flip it immediately because I couldn't stand it. So what I'm trying to say here is, you are giving some, let's say for instance, you are giving somebody oxygen and the person is lying down. Like, what are you doing? You are giving somebody oxygen, the person is lying on. What are you doing exactly? Let's talk about that. What are you doing? How are you giving somebody oxygen, the person is lying flat on bed? Are you giving that person oxygen, or what are you doing? So please, let's try and do the right thing. And I understand some facility doesn't have, some hospitals doesn't have all those equipment. They don't have the best bed ever. You know, there are so many things that might be lacking in some hospital. But you know, as health worker, we are taught to improvise, right? So let's try and improvise and make comfort the priority for our patients. Anyway, it can be anybody, even at home. Maybe your loved one, you notice the person is having issue with, you know, breathing. The person is breathing, person is having, just come in and help that person. You get? So you mustn't have a certificate as a health worker before you will know the right thing to do. Anyway, I leave you guys with this today. I remain Ruth, your nurse. Thank you, love you, see you next.